Hello, good afternoon, everybody. Thank you for joining us for the webinar on a campaign for a European Year for Rare Disease in 2019. I now announce that the webinar is officially opened. And let me introduce myself. My name is Thomas Kangatona. I'm a client executive for the healthcare team at Burson Marstella Brussels. And it will be my honor for me to moderate the webinar, which will guide you actually through this campaign, which has already kick-started on making 2019 the European Year of Rare Diseases. So today's agenda for the webinar will be the following. So first, we'll hear from Sharon Ashton, Senior Manager at eurordis, on the principal objectives of the campaign. Our second regarded speaker will be Flaminia Macchia, EU Public Affairs Director at eurordis, who will tell us about the value of the campaign at European level. And our third speaker will be Miriam Mann, the Director of AXA, the German National Alliance for Chronic Rare Diseases, a member of eurordis and its Council of National Alliances, who will let us know on the value of the campaign at national level. Our last session will, for the last session, Sharon will take the floor again to let us know, to let you know actually how to get involved for the campaign and in order to make this campaign a success. Before we start with our first speaker, I would just like to let you know of a few housekeeping rules. So after each speaker has spoken, I will open the floor for questions for participants. I will say them out loud after they have been asked. So just for information, you can type your questions in the little chat box on the bottom left corner of the window, stating clearly your name and your organization as well as your affiliation in this box. I've just typed a message here. I type it again so that everyone can see where he should type his question. So you can type, of course, your question at any time during the presentations. They will be grouped together and asked to each speaker after he finished his presentation. Some housekeeping rules for the speakers but I think that they're already aware of that. Of course, when you're not speaking, you will have to unmute your microphone so that we can avoid echoes on the line and so that we can really hear who is speaking. For the participants, we also like to let you know that the seminar is recorded and it will be made available on eurordis website within a week. And of course, should you be interested in knowing and in receiving the content of the presentation or ask any additional questions regarding the seminar or the campaign, feel free to ask them to the following address. It's EYRD2019@eurordis.org. EYRD like European Year for Rare Diseases. 2019 like the year. It is scheduled to take place at eurordis.org. So now that I have introduced the speakers and introduced you actually to the framework or the format of the webinar, we will now hear from our first speaker, Sharon Ashton, Senior Event Manager at eurordis, who will set the scene of the principal objectives of the campaign. And during her presentation, she will address three main questions. First, why the campaign? Second, why 2019? And the third question is how the campaign is actually going to be rolled out. So Sharon, the floor is to you. Thank you.
Thank you, Thomas, and thank you everyone for participating on this webinar. So as Thomas mentioned, I will be giving you some information on the principal objectives of the campaign. So why a European Year for Rare Diseases? Well, first of all, we thought that it would be good to clarify that this is not a eurordis event. This is an initiative that's proposed by eurordis, but it's a year for all rare diseases and for all stakeholders in the rare disease community. So the success really lies, and we can't stress this enough, at the national level, at the regional level, at the local level, so on the ground. Why 2019? Well, for several reasons. First of all, because we will be celebrating the 20-year anniversary of the adoption of the EU regulation on orphan medicinal products. We'll also be celebrating the 10-year anniversary of the Council recommendation and Commission communication on rare diseases. It will mark the end of the Health for Growth and Horizon 2020 programs. And it will be a pivotal year, namely because that is when the budgets will be renegotiated for the EU multi-annual financial framework from 2020 to 2025 and the next health and research programs. So it's a three-step public awareness campaign. The first step that we are already in the middle of is step 1, building support. And as Thomas mentioned, at the end of this webinar, I will be presenting how you can get involved and how your constituents or your members can also get involved. Step 2 is the development of policy actions, which takes place from 2015 to 2018. Flaminia will be saying a little bit more about those. And then step 3 is the year itself, 2019, we hope, the European Year for Rare Diseases. So just to go into a little more detail about the building support phase, step 1. As I mentioned earlier, this is really a patient advocacy movement. So we have the official call from eurordis for a European Year for Rare Diseases, but this is on behalf of you. So it's on behalf of our national alliances, European federations, all of eurordis' members, and rare disease patient organizations in the EU. Then the broader picture is the political and partner support. So this will include, but not be limited to, the Commission Expert Group, MEPs, which are members of the European Parliament, national authorities, commissioners, first ladies, opinion makers, and regulators. And then even broader, of course, it's engaging a maximum number of people, organizations, research institutes, medical universities, industry representatives, anyone who would like to join the campaign for a European Year for Rare Diseases.
And the frame of the campaign, and also feeding us into why the year 2019 is so relevant, and how actually all the pieces of the rare disease puzzle actually converge towards this year. Now, I will now open the floor for a few questions from the attendees. So I will type again in the box where you can ask them. And I hope there is going to be a lot from the audience. Okay, I see that Hal Skara from PHA Europe. Okay, okay. Hal Skara from PHA Europe is saying that she needs to hear, or he needs to hear more before she has or he has questions. But I already have one actually for sure, and maybe it will help the participants think of a few additional ones. The first question is actually, you know that a new European Parliament was elected in May 2014, and it has already started to work. And has eurordis already reached out at a European level to these members of the European Parliament?
Yes, we did. Actually, this has been done in two phases. So the first phase actually took place before the elections for the European Parliament, which took place in May. So before that, Eurordis sent letters asking specific MEPs if they would be open to this initiative and if they would support this initiative. We also sent the same information to our national alliances and invited them to do the same, to contact their own national members of the European Parliament, the candidates for the European elections. We did have some success ourselves and also from some of our national alliances, including, I must say, Germany. So we were very pleased with that. And then the second phase, as Thomas mentioned, the elections have now taken place and new MEPs are in place. And we have sent congratulatory letters to the new MEPs and also including information about the campaign and asking them if they will support the campaign.
Okay. Okay, thank you very much for this information. Just building upon that, so I see that you are actually already in the middle of the bidding support phase. Is there any lessons learned that you would like to share with the participants so that they can already start to maybe have a best practice or have some examples of what they could do at national level?
I think the lessons we've learned so far are that indeed we need to make it clear that this is not a eurordis event. It's really for all patient organizations, all national alliances, and all stakeholders really that are involved in the rare disease environment, because the purpose of a European year is not only to raise awareness. That is, of course, a priority, but it's also to try to shift attitudes for society to become aware of the issues that are faced by rare disease patients on a daily basis and their families and caregivers, but also so that society becomes more inclusive of these people. So it's, first of all, an awareness raising initiative, but also to reach out to policymakers. So we want to make that clear to everyone that the success really lies at a national, regional, and local level.
Okay. Okay. So in the meantime, we have received a question from Michael or Michel Ras or Reis. Unfortunately, his affiliation is not indicated, but he's asking how can research organizations actually support this initiative. So it's actually really pretty much in line with what you said, saying that actually there is a whole community, not only policymakers, not only patients, but everyone who should be involved. So Michel is asking how the research community can support best this initiative.
That's correct. The research community, as all other communities, can all be involved, and I will be presenting specifically how you can do so, which is relevant to everyone later in this presentation. Webinar.
Okay. So let's try to keep some for later then. And one last question, if I can ask you to maybe capitalize on that. You say that actually yes, the outcome of the European Year of Rare Disease is actually trying to get to know the people and the public opinion actually to be more aware of the rare disease and try to have a more inclusive society. Are there any external partners that you already have for the rollout of this campaign?
Well, I would say, of course, predominantly they are our national alliances. They're our member organizations, but they're also the whole research community, medical institutes, medical universities, their industry, their medical devices manufacturers, all of the above.
Okay, okay, okay. So it's really an encompassing and really far-reaching initiative.
Yes, and I think
So,
predominantly what we would like is for this to go viral. I mean, we need just speaking to 5 people yourselves, then they speak to another 5 people, and so on and so forth. There are 30 million people living with a rare disease in Europe. We could at least expect a tenth of those people to sign up and support the initiative. So that's what this is all about, getting the word out, spreading the word, and gaining support.
okay, that's very nice. So thank you very much, Sharon, for presenting on the principal and objectives of the campaign. And now we will now hear from Flaminia Macchia, EU Public Affairs Director at eurordis, on the value of the campaign at EU level, as well as eurordis's supporting role. So Flaminia will also present, as Sharon said before, the indicative actions for 2015 until 2018 and these policy actions. So I give the floor to you, Flaminia, now.
Very much. So, a European year serves as a framework really for all activities around awareness raising. But what do we want to do with this European year on rare diseases? Well, first of all, we want to raise public awareness on rare diseases, because it can seem strange to us, but there are still a vast majority of people who don't know what is a rare disease, and also on the challenges that are facing patients living with rare diseases and their families. We also want to reach out to policymakers and influence their priority setting when adopting their budgets, the public health related policies and research policies. It's really an opportunity for member states to show political commitment and send a strong political message. We also want to promote the adoption and the implementation of rare disease policies throughout the European Union, in each European member state, and also at the EU level. We also want to ensure long-term funding for rare disease-related activities and ensure the sustainability of policies beyond 2020. And of course, we want to enhance our voice at European level. Yes. So what will eurordis do? So eurordis will develop and coordinate and disseminate a common roadmap for the European year to serve really as a framework for national, regional, and local initiatives and activities. I mean, all of that has to be consistent, and we have to ensure this coherency. So eurordis will develop a communication plan and information tools, including leaflets, possibly brochures. But these information tools will be presented later on by Sharon at the end of the webinar. eurordis will coordinate and collect the sign-ups from all the supporters. We have a common module on the eurordis website. We will promote the European year at EU level, and we will coordinate the campaign targeting the members of the European Parliament and also other EU officials. eurordis will develop and disseminate the call broadly at European level. We will organize, hopefully, a European level event. You are all aware, I guess, of the Rare Disease Day, and that we organize a policy event in Brussels. It's going to be a bit the same kind of idea, to organize something as well at European level, in addition to all the national, local and regional activities. We will encourage press and media coverage and try to create some buzz on social media. We will provide some guidance to the national alliances to support their roadmap, including some essential policy elements, but we will also foster collaboration between European federations on strengthening the rare disease patient's voice. The overarching goal is, of course, to reduce the impact of rare diseases on patients and their families, but the specific objectives that we want to address are, well, first of all, to improve access to rare disease therapies, including orphan medicinal products and diagnostics, to promote a fair reimbursement in order to reduce the inequalities to access the orphan medicinal products. We want to encourage basic and clinical and translational research in rare diseases. We want to create the conditions for better health and medical and social care for all wherever they live in Europe, including fighting against the exclusion and discrimination, including the fight against genetic discrimination. And yes, I think I will stop here. Thank you.
Thank you very much, Flaminia, for this presentation and for explaining a bit further actually the coordinating and the coordinating role of eurordis, as well as your indicative objectives at for the end of the campaign. So now, just like for the first presentation, I will open the floor for a few questions for participants. So I see that 2 participants are typing questions. Okay, so Hal is asking if there are any common dates planned for the event. So it's a question from Hal from PHA Europe.
Well, no, actually, there are no dates planned so far. I mean, of course, we are starting well in advance, also because you have to start creating support and propose all of that to the Commission and the European Parliament, who are in charge of designating the day at least 3 years in advance, but there are no dates fixed for the moment.
Mm-hmm. Okay.
Apparently, I have to speak louder.
No, it's perfect. There was Juan asked us a question actually regarding if there was any manifesto that can be sent actually to interested parties so that they can also recycle it for their own members of the parliament. Just to let you know, Juan, I think that the best thing to do would be maybe to follow up with the speakers and the people who are in charge of the campaign here at eurordis, who will send you these manifestos. So we've in the meantime received 2 questions. One from Serena from Italy, from Aichi Onlus. She's asking if actually the disseminated material, will be translated.
So, as you know, there is no particular funding from the Commission for a European year. There might be some networking funding that, if we get it, we would use certainly to translate as many information documents as we can. So we hope so, but it will of course depend also on the budget available.
Okay. Okay, thank you. And you said that actually the year of the campaign is only announced 3 years, is announced 3 years before the campaign actually starts. do you have already an idea of when approximately this decision will be announced for this European year?
Yeah, so what I meant is not that it's announced 3 years in advance, it's that you really, I mean, we were advised to start really approaching different decision makers at least 3 years in advance. And of course, in order to be able to approach them, we have to build some support beforehand. This is why we're starting so early in view of 2019. When it comes to the official announcement, that is really very last minute. I mean, we went through the previous years because maybe you know it started in 1983, the European years. And so we have seen that most of the years are announced the year before, and some of them, like in September the year before, and even in December. We have had a case that it was officially announced in December for a year started in January. So the official announcement is really last minute.
Okay. Okay, so you still have ample time actually to try to build up support for the campaign. So I have another question from Hal from PHA Europe. She's asking actually that her organization has members from countries outside of the EU. So will the campaign will be run there outside of the EU as well? And she says she also points to problems with countries that have problems with availability of treatments there.
Well, I guess that it's always useful to use the legitimacy of a European year in order to empower and be able to advocate your own national governments and authority. So of course they can use it as a good practice and say, well, look what they're doing in Europe, we should do the same here. So of course everybody is welcome to build on the raising of the awareness, and we hope to create enough buzz so that everybody at global level could use it. But it's a European year.
Okay, thank you very much, Flaminia, for your complimentary information. I will now turn to Miriam Mann, the director of AXE, the German National Alliance for Chronic Rare Diseases, and a member of eurordis and its Council of National Alliance, about the actual implementation of the campaign at national level. So this presentation will help participants look into what added value the campaign can bring at national level in terms of adoption, implementation, or renewal of national initiatives to improve rare disease care and treatments. And it will also help participants know how national organizations can help make a successful European Year of Rare Disease 2019, and not only national organizations, but also all interested people, of course. So I'll give the floor to you now, Miriam.
Thank you, Thomas. It's a great thing that we're trying to improve awareness on rare diseases everywhere in Europe. As for each national alliance, the main goal of our work is to get awareness with physicians and politicians, etc., because increased awareness ensures better decisions, lesser mistakes, and at the end will improve lives. So awareness is a very important goal, and I'm convinced that if we together start a campaign to get a European year in 2019, the whole buzz created by that, the theme setting, will improve awareness also on a national level. And we should not think about it on what it will, not only think about what will happen in 2019, but at least as much about the process getting there. The whole idea of starting a process, a campaign to achieve it will be a success even if we do not get a year in 2019. I think the whole campaign will encourage debate and European themes, if they are discussed in a lot of people, it will draw national attention. In our experience, politicians do not wish to have well, do wish to have a good answer. If the EU asks them a question, if what are they doing, what is happening in your country, they don't want to be the only country where nothing much is happening. So European initiatives certainly will encourage debate, and this encouragement of debate and agenda setting will be a support to implement rare disease policy. So I think it's a good instrument of keeping movement in our issues and in our themes. The role, you asked me to speak about what the role of the national alliances could be, which would be on the next slide. There are different very obvious roles of which a national alliance can play, and which are also probably essential for the success, is that we should build up support, address our member organizations, the people active in the field, for rare disease, everybody we know, in much the same way as we do on a Rare Disease Day, to get activities to make sure things are moving and the theme is heard. Circulating the official poll and the question and answering documents broadly, of course, is needed and helpful. So on the one hand, there should be support efforts to get the message across. Next to that, the national alliances should consider what they wish to achieve politically in the coming years and how they can use that process to really discuss specific themes and think ahead already of what these themes might be, so that the message will have the best substance possible, and so that we can benefit from the momentum we're hopefully creating. Seeking funds for local activities in that end is going to be, of course, a big issue. As Flaminia said, there will not be money from the year itself, and especially not while we're campaigning for it to get it in the first place. So that will be an issue. I do think it can be helpful to speak to your bigger funding organizations that are used to this kind of campaigns, like Lotto or this kind of big funds, to tell them about the year and say, you can have, if you make a title or a special event of it yourself, maybe they can be motivated to give funds for this particular year. And of course, encouraging press media coverage and putting everything on Facebook and trying to get a buzz with. So try and be an ice bucket challenge. Something like that would of course be great, but it's the only way that to show that it's not an institution wish, but something the people want. If the people concerned express loudly and authentically that they want to be heard, then we will be successful. We will not be successful if only managing directors like myself are going to say that in some nice webinar or somewhere in meetings. We need to be active, all of us. And writing to heads of states, first ladies, prime ministers, and all these kinds of things belong to that. But I do think the public support of many is going to be the most effective part of it. So, and then we have a last slide on how it could be, how that support could be translated on a local level. We do have in our own Rare Disease Day, and in Germany, for example, local groups that organize city events with local, as a result, local groups get to know each other and are active for this event. And I do think for European Year, something similar could be done. The groups can have at least as important a role as the national alliance, because they're close to the people concerned, and they should keep the buzz going, communicate the issues, and give the campaign their support. Yeah, well, it is, as Sharon said, it's an event of us all, and it will only work if everybody try to get the attention to this idea. Thank you.
Thank you very much, Miriam, for explaining the benefits expected from leveraging this European Year for Rare Diseases at national level. Your input and your indicative actions will sure be helpful in order to help shape the initiative at national level and to build support within the rare disease community and of course outside. So as for the previous presentations, I will now open the floor to questions from attendees. Okay, so I have a question, another question from Hal from PHA Europe. Does eurordis plan to develop campaigns or events that so I think that you mean that we can use actually. That I guess it is a national or participating organizations can use.
Oh, I hope they will, but that's something Sharon can answer, no? Because that's what eurordis is going to offer. They always make for the rare disease day. eurordis offers extensive toolboxes with lots of ideas and many technical support, and I'm sure there's something great similar to that is going to be there for the European Year on Rare Diseases. But Sharon will tell us all about that in the fourth presentation.
Well, Sharon will explain a bit later on the information tools that we're thinking about. But of course, if we're going, and hopefully we are, going to organize an event at European level, you're of course, we will all be invited to participate, and this can either be, I mean, a meeting will be done at European level, and hopefully other meetings will be done at national level and even much more local. So the brochures, the information, the toolkits that will be developed will be available for everybody who wants to participate in the European Year on Rare Diseases.
Okay, so Hal, hold on. We're getting there. We're gonna discuss the events in a few moments. So I have maybe a few questions for you, Miriam. Could you please just explain a bit more what the roadmap is, the roadmap that you've mentioned in your presentation? Could you please let us know what it is and how what are the objectives and how do you see the breakdown of this roadmap in actions?
Yeah, well, it's a bit early to sort of plan out the complete roadmap now. It's the point wants to say more that it is good to bring the awareness campaign thought and your content, your political goals, to sync them in some way and say, well, if you want to achieve better centers or more registries or a particular problem, I don't know which the problems of the different national alliances are, and which one of those are most urgent and so on. That's something the national alliances have to discuss for themselves, but it offers an opportunity to combine events for the campaign and the buzz around it with a focus on certain aspects or certain goals that you want to achieve predominantly. But that's a preparation thing the National Alliance has to do. I cannot give out a roadmap. The roadmap of the German Alliance necessarily has to be quite different than the French or Polish roadmap or something like that.
Okay. Okay. So it's thank you very much for the clarification. And I would also like to ask you actually what is the what would you actually suggest for associations and organizations that don't have that have a limited budget actually? What could you suggest them to do actually? Because we see that there's a lot of different associations which might be interested in taking part of the campaign. So do you have any examples of really simple things to do in order maybe to raise awareness around the campaign for these associations that have less or limited resources?
Yeah, well, I think that's more or less all of us. No? I think I would suggest not to think about it like some enormous additional project that hardly can be managed. It should be synergies need to be used. We should have look at it and see whether we can combine it with meetings that we already have planned, or combine it with events that are taking place anyhow. Partner up with other organizations like the organizations of physicians, or sort of trying to find a smart way of getting attention without setting up enormous extra conferences or something of the kind. And of course, trying, you know, I'm a lawyer, so I'm not that creative, but there are the use of social networks and different actions can have an enormous effect without enormous money involved. So we have to think a bit out of the box there, I think.
Okay. Okay, thanks a lot. If you don't have any more questions, I will now turn to Sharon again, who will share with participants actually where they can find the relevant support documents for outreach at national level. So I think it will be of a particular relevance to Hal. So, so Sharon, the floor is for you.
Thank you, Thomas. Thank you, Miriam. Yes, indeed. So how can you get involved? How can your members get involved? Everyone can act now, so you can sign up yourselves to support the campaign. This is the URL. It's a specific or a dedicated page on the eurordis website for the European year. This page is translated into all of the eurordis website languages. And on the next slide, I will show you what that page looks like. It's quite small, but there on the right is where you can sign up. And further down on the right, you can't see it on this slide, but there is a web counter. So it's a central web counter, so we can see in real time the number of signatures we have received. We're already at over 700. And this page is also accessible via the eurordis homepage. So you can see the logo on the right-hand sidebar at the bottom of the page, bottom right, just here. So as you can see, we have developed a campaign logo. We have a horizontal and a vertical version for you. You can add these to your website, give the link to the web page to sign up. And you can also, of course, use your social media network to spread the word. You can tweet using the European Year hashtag that you can see on the screen there. And like we were saying, you can generate support from your communities at large, which include your family, your friends, your colleagues, association members, but it can be extended to schools, your gym club. I don't know what your other hobbies or passions are, music or dance or whatever. Please feel free to speak to a maximum number of people about this. That also includes your national policymakers. I will be talking in a few moments about the information tools that eurordis already has that you can use. And of course, also extending this to research institutions, academics and scientists, healthcare professionals, centers of expertise, and even further to the contacts you may already have with pharmaceutical or biotech companies, medical device manufacturers, and investment firms. So the whole rare disease community and beyond. And last but certainly not least, media. So the media contacts you have, please inform them about this initiative. They are often interested in patient stories, so please feel free to use this as a means to communicate on a broader scale with media. So the information tools that we already have available for you, and they are all available on that dedicated page on the eurordis website for the European year. We have the official call for a European Year for Rare Diseases. That document is already available in all of our website languages. There's also a frequently asked questions and answers document. That is available in English only. There's an information leaflet also. We have included that on the website, so you can download that. For the moment, it is only in English. However, if you request the design files, we could always forward those to you, and you can insert the text in your own language. As I've already showed to you the campaign logo, both of the formats, please feel free to download those and include them on your website. As you will have noticed, we have purposely made the campaign logo similar to the hands of the Rare Disease Day logo in the different colors because of the synergy between the two events. We also have a template letter that we have drafted that you can personalize and send to your national policymakers. That is available in English. And there's also a video that our Chief Executive Officer, Jan Le Cam, has recorded that is available on our eurordis TV channel. And that is in English, but please feel free, if you would like to add subtitles in your own language, to contact us about that. So here is just a reminder of the campaign task team. Of course, if you have questions at a national level, if you see any of your countries represented here, feel free to contact them or to contact us directly. We have 3 of the eurordis board members involved on the task team. They are Avril Daly from the Irish National Alliance for Rare Diseases. We have Dorica Dan from the Prader-Willi Association in Romania, and John Dart representing DEBRA International UK. We also, of course, have staff members. So our Chief Executive Officer, Jan Le Cam, is involved in the campaign, as is Flaminia, whom you've just heard from. Our Communications Director is Laura Chappell, and we have Dennis Costello, who is also the manager of our online patient communities, who is involved. Anya Helm, who is our patient relations senior manager. Jill Bonjean, who is involved in development at eurordis. Zoe, who is the deputy to our CEO, and myself. We also have 4 members of our CNA-CEF, that is our Council of National Alliances and Council of European Federations. So they are represented by Pisana Ferrari from the PHA Europe, Pulmonary Hypertension Association. We have Alain Fontaine from the Alliance Maladies Rares, the French National Alliance for Rare Diseases. Miriam, of course, whom you've just heard from AXA in Germany, and Maria Tomé from FEDER in Spain. So please feel free to contact any of these people if you have more questions after this webinar. So finally, our last slide is please do help us make 2019 the European Year for Rare Diseases. This again is a reminder of the URL for you to sign up and to share with all of your contacts. And of course, the other generic website, or sorry, email address that is available for questions is on the bottom of the screen now. Thank you.
Thank you very much, Sharon, for presenting us what the webinar participants, as well as the rare disease community, as well as people who are supportive of the initiative, can already do to support the campaign, and where they can find the supporting documents. So I will now again open the floor for a few questions from the participants. So I see that Halina is typing.
And somebody
Okay,
just
well,
sign. Everybody with
yes,
webinar should at least
apologies.
sign.
Okay, so before we receive Helena's question, I have a question to ask you, Sharon. Is there any guidelines that participating sportive people should use when they're using the EYRD logo, and where can they find them? Or can yes, where can these guidelines be found?
For the moment, there has been no official communication about that. However, what we can say is that anyone who is using the campaign logo, we would ask you to respect the same kind of spirit as we do for Rare Disease Day, meaning that the logo should not be used for commercial purposes. And if the logo is used, then it should be used alone in its format that you currently see it. So it shouldn't be altered in any way or cropped or used within a new logo. However, it can be used, of course, alongside your own logo or, for example, commercial sponsors' logos.
Okay, so I think that we haven't received Helena's question. I will still will open the floor again for some other questions. Actually, should participants have any other questions to ask for regarding the content of the other sessions before we move on to the conclusion of the webinar?
So I should have just mentioned as I was going through that last section that, of course, relating to the earlier question about research institutions, they can, of course, also use these tools, put the logo, the campaign logo on their website. We are also planning to put an email signature together that you can embed in your email so that you can send those out. And there's other initiatives under development. So any new information we will put on that specific page of the website. And of course, we will make announcements via our e-news and our social media.
Okay. I have one question from Rob. I think it's for Flaminia, who presented on the value of the campaign at EU level. I think that you've already touched upon a few elements of this, but Rob is asking what the official process is for declaring a European year for of something actually. If you have any
Yes,
more
thank you.
specifications to give.
No, it's good. It's good to have this question. When we tried to contact the European Commission to understand what is the process, it was actually quite clear that the process is not that clear. But in the end, the theme for a European year, so the subject, is proposed by the Commission. So you have to do all the work beforehand. And then the subject is adopted by the European Parliament, which is the legislative body, and also by the EU member government. So, but the way in which you get the Commission to propose a theme and the way you get the European Parliament to adopt the theme and how you get the member governments to accept the theme, this is more of a general advocacy work. It's exactly what we have just started together with you today, and what you have then to do, really, all of you at national level, in your in your patient groups. So it's really, there is not like a formulaire that you have to sign in and you have to fill in and then it's going to go through. It's really building up support.
Okay. Thank you very much for these clarifications, Flaminia. If there are no other questions, I will now move on to the conclusion of this webinar. So first, by thanking you, the participants, for taking the time to listen in this webinar. We all know how your attendance is important actually to build up and to bring to higher and to higher level actually this campaign and this advocacy work in this initiative. I would also like to thank Miriam, Flaminia, and Sharon for presenting during the webinar and for giving first background information and as well as guidance on this campaign. So as I said, both the speakers and the participants' commitments will contribute greatly to the success of the initiative. Once again, my name is Thomas Kangatona. I'm a client executive for the healthcare team at Burson Master Lab Brussels, and it has been a pleasure for me to moderate this webinar. I will just take a few minutes to remind you that the webinar was recorded and it will be made available on eurordis' website within a week. And also, should you be interested in receiving a copy of the PowerPoint presentations, or should you have any questions any additional questions actually to the speakers, as I saw that there were a lot actually which were asked during the webinar, don't hesitate to ask them to the email address which is on the slides. The address is eurord2019@eurordis.org. I repeat, eurord2019@eurordis.org. So I now announce that the webinar is officially closed, and thank you all again for participating.
Thank you.
Thank you. Goodbye.
Thank you very much for participating.
Goodbye.
Thank you. Bye. Bye-bye.
Bye-bye.